Welcome back. Dr. Hansel Tukes runs Miami's Needle Exchange program, and his team sees up close the impact the virus is having on them, many of whom are homeless.
So the first thing that we realized about 4 weeks ago was that they're extremely hungry. People who traditionally feed the people who are experiencing homelessness and living on the streets of Miami are no longer out there doing that sort of outreach. There's fewer people donating money to panhandlers. It's very even the informal economy has a lot of constraints on its growth right now. So the people that we serve are really strapped for cash. So they told us that they were starving. So one of our service lines at the Needle Exchange now is the staff that are rotating at home. They go to the grocery store, they buy sandwich supplies and gloves and masks. They make sandwiches, and everybody who comes to the program now and everybody that we go out to serve gets food along with their injection supplies. The thing that's hardest for us as harm reductionists, people who work with vulnerable communities, is that the hugs that we gave them, the smiles that we gave them, those were all so important in the interactions that we had and our role in society. And now our faces are covered with masks and we can't hug our participants. So that's been very challenging. But at the same time, when you have a mask on, you can still see the eyes and you can see the cheekbones rise when you're smiling at people and letting them know that you are there and you care, even though things have changed.
So, how are they coping?
It's very challenging, and a lot of people who have substance use disorders, they fall back on that substance use when they're coping. It is very challenging. We still have our social workers going out. We still are making sure that we make frequent contacts with people who are having challenges. One thing that we've done in order to try to help people cope with their substance use is we're actually using telehealth now to get people started on what's commonly known as MAT, so drugs like Suboxone that can treat their opioid use disorder and are safe. So now, due to the new guidelines from the federal government, we can do telehealth visits and prescribe these medications electronically. So my students actually came to me and said, we really want to stand up and help in this COVID-19 pandemic. And they set up this virtual clinic. And so we're trying to make it easier for people to get on medications to treat their opioid use at this time.
How many people are you serving right now?
It's interesting. So we have a lot of people who come and they drive in and they come to the program maybe every other week or every month. So those people, we made sure that they had enough supplies so that they didn't have to come down as often so that they could practice the social distancing. In terms of the people who use the program very frequently, there's about 600 people. And a lot of those people, about 40% of them are experiencing homelessness. And what we had to do was adapt for their needs. So we can't give them supplies to last a month because they don't have a place to keep them. We store their medications on site so that their medications are safe, antiretrovirals for HIV, hepatitis C treatment. So for those people, we had to remain open.
The homeless are sort of get forgotten. What experience are you having in terms of dealing with the homeless trust and the homeless shelters? And what do you think this disease has already done with that vulnerable population? And what are your fears as to what it's going to do when it really starts to hit Miami in the next few weeks?
It's very challenging. You see, I'm in my apartment right now. I see thousands of people in their apartments looking out over the bay. And a lot of us have homes that we can shelter in place. If we have symptoms, we can quarantine. If we have COVID-19, we can isolate. For the homeless people in our city, that is not an option. And that has me and a lot of other providers who work with homeless populations very concerned. Right now, I do not believe that Miami is preparing. It's very hard when there's something that everybody is vulnerable to infection with this coronavirus. It's hard all the time in Miami to make people focus on treating people who are homeless with humanity and recognizing that their health needs are a priority. Right now, it's virtually impossible. I don't think that Miami is prepared for COVID-19 infection in the homeless population. And it's really, Jim, it's an unfortunate situation. There are people, it's a typical Miami story. There are people who are appointed to jobs and they're in jobs and don't necessarily have the experience, the public health experience, the social work experience. And I wish for one time in Miami at this pivotal moment that those people would have the humility to ask public health experts and ask physicians how they should be prepared. But unfortunately, they're not doing that.
Okay, so I'm asked, how should we be preparing? What should we be doing to help this vulnerable population?
Yeah, so what's really very important and that we're going to do at the University of Miami is that we're going to start doing testing in partnership with Miami-Dade County. So that will be point of care testing among people who are homeless. And the first thing that will let us do is that will let us show people that there is coronavirus infection within the homeless population. And what everybody in Miami always has to remember is that these vulnerable people who sometimes live life on the shadows, they are part of our society. If you look at the heat maps for coronavirus infection in Miami, downtown and Brickell light up. Well, in those same areas, we have many people who are experiencing homelessness, and they shop at the same grocery stores as we do. They're everywhere that we are, and we have to prevent coronavirus infection within everyone. And that means that if there are people who are homeless and are experiencing symptoms, they need to have immediate access to testing, and they have to have access to quarantine. That means constructing temporary tents where you can have negative pressure. You can have tarps that divide areas, and you can have medical staff there so that if people's symptoms worsen, you can help them. If they have substance use disorders, you can give them treatment for that. If they have mental health needs, you can have mental health providers there. You definitely need to provide the shelter for the quarantine or isolation, but you also need to provide services that people will inevitably need. And so setting up tents for quarantine and isolation would be a very important move. Right now, I'm really not interested in people's infection control and public health opinions if they don't have a medical education or a public health education. And I know that that sounds a little bit out of character for me to say something like that, but this is an emergency and we need to act now. If there are resources that are available that we could start making these moves that other cities like Boston and Chicago and San Francisco have instituted, we need to do those things. In many ways, the mayor issuing the stay-at-home order very early has made it so that we have flattened the curve here in Miami. But there's definitely, I mean, thinking about whether or not we're going to be able to disassemble the tents and where people are aggregating, 6 months down the road. I mean, I pray to God that we're all alive. I pray to God that all of those people who we would serve in those areas are alive. It's very short-sighted.
We'll follow up on this in the days ahead.